Assalamualaikum, my name is Nur Suraya binti Zulkifli. My metric number is HWT10203. I am from group 6. I want to introduce my group mate that is Saidatul, Aisyah, Rifa, Sheikh, Aika, Nurul and Natasha. I want to present my part, which is the introduction. An ongoing medical issue is diabetes. Blood sugar, also known as blood glucose, can be affected by the issue. In this instance, insulin deficiency or ineffective insulin usage by our body causes diabetes to develop. Diabetes can also result in blood sugar building up if it is not controlled. In this instance, there are two different types of diabetes, type 1 and type 2 diabetes mellitus. An autoimmune disorder is type 1 mellitus, a condition known as autoimmune illness occurs when the pancreas, an organ that produces insulin, is attacked by the body's immune system and has its cell destroyed. When the pancreas cells are damaged, the organ can either partially or not at all produce insulin. Information on type 1 diabetes, which is affect 10% of people in this city. Receiving lifelong insulin injection therapy to support the restoration of the body's glucose metabolic process is the only option to prevent this particular type of diabetes mellitus. Additionally, type 2 diabetes mellitus, which is characterized by a pancreas that can be manufacture insulin like that of healthy individuals, has a very high level of cell-level insulin resistance for the process of sugar metabolism. In the body to function properly, the individual in question must require more insulin. Follow the right guidelines by living a healthy lifestyle using medical issue. In this instance, insulin deficiency or ineffective insulin usage by our body causes diabetes to develop. Diabetes can also result in blood sugar building up if it is not controlled. In this instance, there are two different types of diabetes, type 1 and type 2 diabetes mellitus. An autoimmune disorder is type 1 mellitus, a condition known as autoimmune illness occurs when the pancreas, an organ that produces insulin, is attacked by the body's immune system and has its cell destroyed. When the pancreas cells are damaged, the organ can either partially or not at all produce insulin. Information on type 1 diabetes, which is affect 10% of people in this city. Receiving lifelong insulin injection therapy to support the restoration of the body's glucose metabolic process is the only option to prevent this particular type of diabetes mellitus. Additionally, type 2 diabetes mellitus, which is characterized by a pancreas that can be manufacture insulin like that of healthy individuals, has a very high level of cell-level insulin resistance for the process of sugar metabolism. In the body to function properly, the individual in question must require more insulin. Follow the right guidelines by living a healthy lifestyle using medication and taking other preventative measures to ward of type 2 diabetes mellitus. The symptom cause and therapy associated with each form of diabetes have been identified as distinctive and varied. That's all for me. Thank you.
Hi, my name is Nurul Atira binti Muhammad. My metric number H22A1234. I will present what the anatomy or structure part of body system involving their grand normal function. First, pancreas. The pancreas play a crucial role in diabetes as it produces insulin and hormone that regulated blood sugar level. Second, liver. The liver also play a role in diabetes as it helps regulate blood sugar level by storing and releasing glucose as needed. Last, muscle. Muscle play an important role in diabetes as then responsible for using glucose for energy. When glucose enter the bloodstream after a meal, it is taken by muscle and used for energy as strong as glycogen for later user.
Assalamualaikum. My name is Siti Nur Aisyah binti Ismail and my metric number is HWT10203. I will continue present the normal function. Fat cells. Fat cells also use glucose for energy, but insulin is needed to transport glucose into the fat cells. Fat cells or adipose tissue play a role in diabetes by releasing hormones and other signaling molecules that can affect insulin sensitivity and glucose metabolism. Excess body fat, particularly visceral fat located around the organs in the abdomen, is associated with a higher risk of insulin resistance and diabetes. Blood vessel. High blood sugar levels in diabetes can damage the inner lining of blood vessels, leading to endothelial dysfunction. This can cause inflammation and narrowing of blood vessels, reducing blood flow to organs and tissues. It is important for people with diabetes to manage their blood sugar levels carefully and work with their healthcare team to prevent or treat any complications that may arise. Nerves. Diabetes can cause damage to the nerves, which is known as diabetic neuropathy. This can affect the function of nerves throughout the body, including those that control muscles, sensation, and autonomic functions such as digestion and blood pressure regulation. Symptoms of diabetic neuropathy can include numbness, tingling, and pain in the hands and feet, as well as digestive issues, urinary problems, and sexual dysfunction.
Assalamualaikum and hi, my name is Zaifah Kuratua Aini BZD. My matrix number H22A0613. I want to present how does the disease happen. Diabetes can damage blood vessels in the heart, eyes, kidneys, and nerves if left for so long. People with diabetes have a high risk of health problems including heart attack, stroke, and kidney failure. Diabetes can cause permanent vision loss by damaging blood vessels in the eyes. Symptoms of diabetes include feeling very thirsty, needing to urinate more often than usual, blurred vision, feeling tired, losing weight unintentionally. Type 1 diabetes, insufficient insulin. Diabetes previously known as insulin-dependent juvenile of childhood onset is characterized by deficient insulin production and requires daily administration of insulin. Type 2 diabetes, insulin resistance. Affects the way your body use sugar for energy. It also prevents the body from using insulin properly, which can cause high blood sugar levels if not treated properly. Type 2 diabetes can cause serious damage to the body, especially the nerves and blood vessels. Diabetes can be prevented if treated properly.
Hi, my name is Syed Izzat Syami bin Syed Mohammed. My matric number is H22A0024. Today, I want to present second point of how does the disease happen. Diabetes is a chronic metabolic disorder that affects the body ability to regulate blood sugar levels. There are two primary types of diabetes, type 1 and type 2, while their underlying cause and mechanism differ. Both types involve multiple body system. Here's an overview of the anatomy and body system involved in the development and progression of diabetes. First, pancreas. The pancreas is a glandular organ located behind the stomach. It plays a crucial role in diabetes as it produces and releases insulin, a hormone necessary for regulating blood sugar levels. In type 1 diabetes, the immune system mistakenly attacks and destroys the insulin producing cells in the pancreas. In type 2 diabetes, the pancreas initially produce insulin, but the body cells become resistant to its effects over time. Second, endocrine system. Endocrine system is a network of glands that produce and release hormone into the bloodstream. Insulin produced by the pancreas is one of the key hormones involved in diabetes. In addition to insulin, other hormones like glucagon, cortisol, and growth hormone also play a role in blood sugar regulation. 3. The digestive system. The digestive system breaks down food into nutrients, including carbohydrate, which are converted into glucose. Glucose enters the bloodstream, and insulin helps transport it into cells for energy production. In diabetes, the impaired insulin function leads to elevated blood sugar levels. 4. Liver. The liver plays a significant role in glucose regulation. It stores excess glucose as glycogen and releases it when needed to maintain blood sugar levels within a normal range. In diabetes, this balance is disturbed, leading to abnormal glucose production and release by the liver.
Hi, my name is Nurul Aisyah binti Baharudin. My metric number HWT10203. Diabetes can treat by practice the following measure. 1. Do physical activity such as exercise will keep the body healthy. 2. Lose weight. In this way, diabetes will be less when sugar intake reduces. 3. Practice a healthy lifestyle, such as reducing alcohol and cigarette consumption. 4. Eat a healthy diet. Eat food that have good nutrition, such as vegetable and fruit. Among them are berries and spinach.
My name is Nur Natasha binti Cik Rusli. My matric number is H22A0719. I will present for conclusion. As for conclusion, diabetes is a life-changing condition that requires careful blood sugar management and a healthy lifestyle for a person to manage itself. These two types of diabetes can be prevented with eat healthy diet and avoid sugar and saturated fat, and other few steps that have been suggested by the doctor. Thank you.